New at 10, health officials are seeing cases of RSV steadily increase in Wisconsin, saying the illness can have a greater effect in children.
And it's important to know how to spot it in your kids. News 9's Isaac Dinesen is live in Weston with how RSV differs from other diseases. Isaac.
Yeah, good evening, Brad, Catherine. Now, RSV is similar to other respiratory diseases like COVID-19 and influenza, but I'm told a lot of adults may get it and not feel much as a result. But it's the ones with smaller lungs that are at a greater risk.
We're always cautious about illnesses in the small children. This is one of them to be cautious of.
RSV, or respiratory syncytial virus, goes through its seasons like other viruses, and we're in the middle of it right now.
It's characterized by classic cough, cold, chest congestion, wheezing type symptoms.
Wisconsin has recently seen more than 500 people test positive for RSV in 1 week. So what separates it from other viruses?
You or I could get RSV and we just think we have a cold for a few days or a week, whereas a premature infant or a 2-month-old who has small lungs may see some more significant impact from that.
These kids can get really, really sick, have a difficult time breathing. Those are kind of the high risk, is those young babies that really just can't fight it off.
The best way to keep it away is by practicing good hygiene, just like keeping away the flu or COVID-19.
Washing your hands, wearing a mask where you're supposed to wear a mask, and if you're sick, avoiding contact with people.
I always say, I give the mantra, don't kiss my child. I don't care how cute she is. I don't care how adorable you want to snuggle up to her face. But adults usually do fine with RSV. We may not even know that we have it.
After case numbers had started to rise as early as August, Dr. Goyle doesn't believe this round of RSV will last long.
From all accounts that I've been hearing and reading and asking folks about is that we are on the downswing from that spike of RSV.
And if you think you or a loved one may be at risk, Dr. Goyle says you should bring any questions you may have to a medical professional that you trust. Live in Weston, Isaac Dinesen, News 9 WAOW.